All right, so up until now, if you've been following me for parts 1 and part 2, you keep hearing me say timing matters. Timing is everything. But what is timing? What does that mean? Am I talking about your age? Yes, I'm talking about your age, and I am also talking about where you are in your menopause journey. Yes, timing does matter. I really want you to know that, yes, although timing is everything, because that's what the evidence does show, to my ladies who are older than 60, there is no research that shows that starting hormone replacement therapy after the age of 60 will lead you to an early grave. I want to place emphasis on the fact that this is something that you and your provider need to have a collaborative decision about. Now, the research does show that the window of opportunity is within 10 years of your final period or before the age of 60. That's when hormone therapy offers the most benefit with the lowest risk. Starting too late, meaning 10 years after menopause, can slightly raise the risk of heart disease or clotting, but that's because your arteries have already changed with your age and estrogen loss. However, when it comes to breast cancer, the main driver is not your age, it's the duration and the type. Combined estrogen and progesterone therapy can gradually raise risk with long-term use. Estrogen only does carry much less risk, and in some studies, even lowers breast cancer risk. So your question is, am I too old or too young to start menopause hormone therapy? Ideally, perimenopause would be a great time to start. Too old, maybe 10 years or so after you started menopause. Now, that is just what the evidence is showing. However, that you should have a conversation with your provider about that. So for most healthy women under the age of 60 and within 10 years of menopause, hormone therapy does remain safe, effective, and most reliable way to relieve your menopause symptoms. But caveat is that's when it's used for the right duration and monitored by a knowledgeable provider.